Hi, everyone. Thank you for joining us for today's webinar, Facial Gua Sha for Appearance Enhancement and Facial Conditions, Choosing the Right Tool. My name is Robin Pierce, and I'm the Senior Brand Manager at L.AC OMS. First, let's take a moment to acclimate to the webinar room. To the bottom right of the screen, you'll see two tabs, Questions and Chat. To connect with other attendees or notify us of any difficulties, please use the Chat tab. At the end of the presentation, we'll use the Chat tab to post a promo code specific to this event. If you have any questions for Shellie or Carrie, please use the Questions tab. Your questions will be answered at the end of the lecture during our Q&A session. Please note that each webinar is recorded, and immediately following the conclusion of the webinar, you'll receive a link to view the video on demand and a copy of the slides. We're excited to have two fantastic presenters with us who will be sharing their expertise and insights. Dr. Goldstein has been practicing cosmetic facial acupuncture for over 30 years and is considered to be one of the worldwide experts in the field of facial acupuncture for appearance enhancement. She's the author of Your Best Face Now, Look Younger in 20 Days with a Do-It-Yourself Acupressure Facelift, and the creator of the Touch and Glow, the Do-It-Yourself Acupressure Facelift Kit. Dr. Goldstein founded the Academy of Advanced Cosmetic Facial Acupuncture, which has recently partnered with the Pacific College of Health Sciences to present the Facial Applications of Cosmetic Enhancement Training Program. Dr. Hart is a nationally certified acupuncturist and Chinese herbal practitioner with a license to practice in New York. Her specialties include facial cosmetic acupuncture, herbal medicine, and women's health and fertility. She's a member of Pacific College's faculty, where she teaches and supervises in an advanced postgraduate cosmetic acupuncture mentorship program. So without further ado, I'll pass it over to Shellie.
Hi, everybody, and welcome. Thank you so much for coming. This is going to be a really interesting event for you. For those of you who use Gua Sha in your practice, you know that it's extraordinarily effective. For those of you who don't, then you're about to learn. So just to begin, let's look in the poll. I would like to take a poll. If you look at the bottom of your screen to the right, it says polls. We have one up for you. And the question is, do you use Gua Sha in your professional practice? Do you use it regularly, occasionally, or not at all? And I'm talking about facial Gua Sha. So go ahead and fill that poll out as we get started, Stephen, and we're going to teach you why you should be and the advantages of using facial acupuncture, facial Gua Sha in your acupuncture practice. So Stephen, if you can go ahead and advance those slides. And for those of you who are, while we're waiting, just go ahead and fill out that form. So what do we want you to get out of this presentation today? What we're going to do is Carrie and I are going to review facial Gua Sha for facial conditions and appearance enhancement. We're going to help you to understand the tools, the shapes, the sizes, the nature of them, the gemstones. As you know, all gemstones are a little bit different, and it makes a difference when you're using facial Gua Sha as to which stone that you use. And then how to select facial Gua Sha tools for our numerous conditions. And Carrie's going to go over how to learn different techniques for certain conditions and concerns, just so that it's a little bit easier for you and you have more information in terms of the right ones to choose. To get you started, let's think about how we would use facial Gua Sha, taking into consideration that there are really significant anatomical and morphologicals that change over time with the aging face. And it's on multiple layers. We're looking at changes at the bone level, at the muscle level. On top of the muscles of the face, there's fat, and then there's skin. And then the skin is made up of both the dermis and the epidermis. The epidermis is what you see when you look in the mirror or you look at somebody else, the outside of your skin. But really the true health of the skin resides a little bit lower in the dermis. So we're going to look at the impact of Gua Sha on the epidermis, the dermis, the muscle layer, the bone layers. And then the top two concerns is what we're going to focus on today. Because if you look above at the image of the people, the aging faces, you see that there are significant changes that occur visually and systemically in the face. The top two concerns for facial acupuncture treatment for us as facial acupuncturists are wrinkles and fine lines and sagging skin. So we'll go ahead and change, Stephen. We're going to look at how facial Gua Sha impacts both of those symptoms. Great. One thing to know that is a little bit different about the face is we talked about the layers of the face, the bone, the muscle, the fat, and then the skin. What's very unique about the face are the muscles. We have two layers of muscle in the face. We have the deeper muscles, and then we have something called mimetic muscles. These are very, very flat, striated muscles that rely just superficial to the skin. And they're the only group of muscles in the entire body that that affect the skin. Most muscles of the body are designed to move bone or ligaments. Muscles of the face, these mimetic muscles, they're actually designed to move the skin. They attach on one end either from bone to muscle, and on the other end from muscle to the skin. And when they're stimulated, they contract, the muscles move from insertion towards their stationary origin. And what the insertion is the skin. And so it's going to pull on the skin and it's going to create a facial expression. And that's how we get facial expressions. Go ahead, Steve. You can change to the next one. Now, you have bones, muscles, skin, and fat, and connecting and dividing them all is connective tissue. And on the face, we have something called fascia. Now, fascia is a form of connective tissue. Connective tissue, not all connective tissue is fascia, but all fascia is connective tissue. And on the face, we have two layers. We have a deep fibrous layer of dense connective tissue that lies superficial to the fascia. And its job is actually to cover the muscles, the bones, and the nerves, and to protect them. Whereas the superficial layer above lies more superficial to the deep fascia and in between the layers of fat. And its job is actually to connect the muscles and the deep fascia to the skin. And it's called the superficial muscular aponeurotic system, or the SMAS layer. And the SMAS layer, again, you see them all lined up horizontally, but they actually kind of connect to one another. And so the superficial fascia connects to the deep fascia, which circles and protects the muscles. And so when that superficial fascia moves, it's going to actually cause those muscles reactions to the skin, which makes the skin move. And its purpose is to transmit, distribute, and amplify the activities of all the face muscles, which you see as an expression on the face. Now, fascia is a huge sensory organ, and it actually has 6 to 10 times more afferent free nerve endings than muscles. So what does that mean? It means that as a sensory organ, it's going to respond to external stimuli, it's going to convey impulses, send them to the nervous system, and gives the brain kind of an orientation of what's going on in the sensory level with the entire body and the surface of the skin. It's made up of, it looks like a little cobweb if you look at that top image. And even though you can't see it in an MRI, a CT scan, or an X-ray, it's there. And it's designed to both compartmentalize the muscles and the vascular system, like the segments of an orange, but also to connect everything. And it's designed to do that via a layer of hyaluronan, which is a fluid that helps that sliding muscle motion. So it connects to everything, everything slides appropriately. It has collagen fibers in it. We all hear about collagen. It has a very important role in both affecting blood vessel flow and lymphatic flow and all the flow of everything throughout the body. In fact, it's believed that when we insert an acupuncture needle into the skin and we get that sensation of Qi, well, that's the transmission of kind of the movement or that electricity that flows through the fascia from one place to another. Okay, Steve, go ahead. We spoke about the lymphatic system. The lymphatic system is what filters all of the excess, all of the waste, and all of the unwanted fluids from the body. And this is one of the primary benefits of facial Gua Sha. The lymphatic vessels run parallel to the circulatory system. The lymphatics lymph from the body and the face, they run through the body. From the body, it runs up to the head. From the head, it moves down towards the heart and the lungs, and it all kind of meets at the subclavial vessel. So it runs through the body, it goes through nodes. The nodes clean out the unwanted waste from that fluid that gets absorbed into the lymphatic system. And then it takes it through the subclavial area, filters it one more time, and then returns it to the circulatory system. So from an acupuncture perspective, that subclavial vessel, or that place that it empties, is right at the kidney 27 area. So one of the ways to actually stimulate the lymphatic system is to tap right at the kidney 27 and the lung 2 area. And as you tap on those areas, you can actually feel your throat starting to have fluid in it. So it makes you swallow. Go ahead. Go ahead, Stephen. Now, one thing about the lymphatic system is that because of its proximity to the circulatory system, as we see arterial veins pump fluid, it then filters through the venous system via the capillaries. Well, sometimes fluid leaks out of that area. And then also there's the accumulation of fluid in the tissue. And it moves through the interstitial tissue into the lymphatic system. And then from the lymphatic system, gets filtered and returned back to the circulatory system. Now, because the lymphatic system doesn't have a heart or some type of a mechanism to pump it and move it along, it really depends upon the motion of either skeletal or smooth muscle contraction internally, or externally some type of manual manipulation. Aha, facial Gua Sha. The importance here is that if you can't get that lymph to flow, what happens is it starts to move backwards. And if you look at the balloon in the corner over time, if that lymph accumulates, like that balloon starts to fill up, what happens is that skin or the edges of the balloon actually have to swell to accommodate the fluid. And that's when you get swelling in the tissue and in your face, like we call it a puffy face. So I'm going to turn this over to Carrie, and she's going to talk about facial Gua Sha and all the tools and how to use facial Gua Sha for wrinkles and for tissue. Go ahead, Carrie.
Okay, hi everyone. Thank you so much, Shellie. So when we're also thinking about that balloon and the lymphatic system, we're thinking about the stretching of the skin. So over time, as the fluid accumulates, especially in the really delicate soft tissue under our eyes, that skin isn't going to have the elastin to have it move back into the original way that it was with that nice smooth look. It's going to have that deflated balloon look. And so when we're thinking about selecting our tools and shapes, I always start with learning about how to drain the lymphatic fluid. So keeping in mind that if you are just incorporating Gua Sha into your practices now, and it's something new, either to your practice or even for your own personal care, start with a more basic shape. So what are those basic shapes that are really effective for the lymphatic drainage? Thinking that the lymphatic drainage is a lighter touch. It's specific strokes on the face to drain at the lymph nodes, and the shape can be more basic for this. And so starting your treatments with the lymphatic drainage is absolutely where I start every single treatment. I also end with it. So this is key and cornerstone to have in your toolbox, and also to provide for your clients. It's nice that your facial cosmetic patients can take a Gua Sha stone home and continue the treatment on themselves in their daily skincare routine. So where do I start? I start with the heart shape. So this heart shape is one that is very easy to use. And why is this important to select the tool that you're comfortable with is that when you're working this closely and intimately on someone's face, they are going to feel your comfort level. So as you are working over time and developing your fine motor skills and the right pressure, the right stroke, and the right rhythm, having a tool that is more basic is absolutely where to start. So what's great about these tools is that they have a long edge that's great for lifting. So lifting that sagging skin, which is one of the primary concerns that people will come to see you for. You can lift from the jawline up to the zygomatic bone, and that long edge of the stone actually fits really nicely under that bone. And you can use it to have a motion, and I'm going to demonstrate in a little while, but just keep it in mind, a motion back and forth at the end of each stroke. So we can use this long edge to lift from the jawline up to the zygomatic bone. And we can also move medial to lateral. So having this edge be vertical and moving medial to lateral out to the hairline. And again, just oscillating the tool, giving it a shake at the end. It's also great for lifting the sagging skin on the neck and the forehead, and then flushing out the lymphatic fluid out to the lung 2, lung 1, lung 2 area. So these shapes also have 3 different pointed ends that can be used to decrease the puffiness in the eyes, but also to really treat the corrugator muscle to decrease the glabella fold. So the glabella fold, is also called the 11s. So it's those lines right in between your eyebrows. And this tool is great to treat the procerus muscle, which is right on the medial edge of your eye, and to release the corrugator above your eyebrows. I also love that it has a slightly longer edge, especially you can see on this tiger's eye heart. The longer edge you can use underneath the jawline and use the smaller tip above. So you're treating both above and below the jawline and removing any of those fascial adhesions that are causing the tight muscles, especially of the platysma muscle in your neck, to pull everything downward. All the way over to the right is a more rectangular shape. This shape is great for those 2 ends that are symmetrical. You can treat the cervical spine with this pointed tip on each side of the spine. So go ahead and advance, please. So here we get into a little more of medium level of tool. So the butterfly shape is really wonderful to treat with because it still has those heart-shaped ends. So the bottom of the tool has those 2 rounded symmetrical edges that are great for treating over the zygomatic bone. So releasing tension from medial to lateral in the face, and using that area to treat the jawline as well. And then the tips of these wings can be used to treat the procerus muscle, so your inner eye, to release the glabella folds, and then also to start to get into a little more advanced techniques of what I like to think of is erasing fine lines and wrinkles. So here you can use the tips of the wings to treat the nasolabial fold. So this is the fold that goes from the nose to, so like B-tongue area, out to the corner of the mouth, which is our stomach 4 area. And it's that line where you want to treat both the beginning of the line, so right at B-tongue, and this tip is really excellent to get into that area. It can go a little bit deeper, and the pressure there is also really wonderful for releasing the sinus congestion that can also cause puffiness in the skin. And so taking that same thought with these wing tips, you can travel the tip down the line and treat across the lines to perpendicularly go between the lines and stimulate collagen and elastin production. So in the demo, I'll show you a way to spread the skin and to really get into those fine lines. But treating right at the beginning of a line and the end of the line, if you're going to do anything more advanced, that's where I start with learning how to do this. And one can also use those wingtips to treat with very, very light pressure, starting to get into some of the crow's feet. Right around the lateral edge of the eye, you can start to really treat this delicate tissue with those wingtips. They're very gentle and they have a really beautiful curve on them that can focus on the fine lines there. So moving all the way to the right, you can see that there is a heart. Oh, can you go back one slide? Yes. So that citrine with the jagged edge. So this is getting into a little different tool that has more to it. So as you're refining your technique and becoming more comfortable, this tool is great because it still has those heart edges, the heart symmetrical curves that can treat the jawline. It also has the nice long concave edge that's great for lifting from jawline up to the zygomatic arch, and then also from medial to lateral, and treating the neck. So lifting and releasing the platysma muscle, and also releasing just below your clavicles. That edge is also great for the forehead. When we're using the shorter edge at the bottom of the tool, that area is amazing for getting into the mentalis area. So now we're treating another line that is a big concern for many clients, which is the line that's often called the marionette line. So this is the line that goes right from the lateral corner of your mouth, so stomach 4 area, down to your jawline. So that size is particularly great for working medial to lateral to release your depressor muscles. So here, these marionette lines, we want to think about what is causing the skin to fold. And as we're selecting our tools, always having in mind what the underlying tissue looks like. So it's not just about what we're seeing on the surface of the skin, but it's how do these muscles look underneath? What direction are they in? And what depth are they at? And then also tying in the fascia that Shellie was talking about. So the fascia, and when we lose the hyaluron and the collagen and the elastin, the fascia gets sticky. And so I always think of folding a piece of paper and a deep crease. Once the paper is creased, how are we going to reduce that crease line when we flatten the page out? So thinking about what tool fits where on the different musculature that's underlying the skin. And so with this jagged edge, we can really start to treat at a different level as well. So utilizing this edge to go perpendicular across the lines will help to stimulate the collagen and elastin and to smooth out those lines, but also using it in the scalp is going to become really important. Our muscles of our face aren't just on the face. They're not just on the face. It's not just about the neck and the chest, but it's also about the scalp. So this jagged edge we can start to use in our temporalis area to release the eyes, the fine lines and wrinkles. Crow's feet are often one of the very, very, very top concerns that people have, but also with the forehead and even getting into those glabella creases, we can treat this frontalis muscle that runs all the way back to our occipital ridge, and really utilizing this jagged edge, not just to treat perpendicularly across the line, but to also really get into the depth of the tissue that is in our scalp, on our occipital, and even deeper into some of these huge posture muscles in the back of our neck. So advance, please. So now this tool here, this size and shape is the one that I have found to be my workhorse. This tool, this gray agate long tool, is the one that I always have in my treatment room. Why do I love this shape? It's because, and when I show the demo, I'll use it, it fits so nicely in the palm of my hand. I've found that using the right size tool for the palm of your hand can really help increase that fine motor skill to have more effect, not just on your deeper muscle strokes, but also on the more subtle, gentle lymphatic drainage as well. Both are very, very important. So this tool is such a great shape to be able to really have those fine motor skills, especially around the eyes, but also when your patient is lying on the table in a supine position, to be able to treat underneath the neck and underneath the shoulder. So to treat the upper traps and the back of the neck, this tool is very easy to use. And I find that my hand has less fatigue during the day when I use this one. Also, the contours on it are really great for many different shapes and sizes of faces. So you have this longer edge that, again, we've talked a lot about, neck lifting from the jawline to zygomatic bone, forehead, and the longer area that you can cover and less strokes you have. It's like when you're massaging the face, when you cover with your hands, it feels really good. So for your client's comfort, it's going to be really nice to have that long side, but then also it has two different sizes of more flat edges as well. So again, great for the mentalis area, but also great if you're having some wider faces, that you have this third long edge option. Now the curve in this stone is for treating the zygomatic arch and also the jawline. So along the jawline, we have this big banded platysma muscle that comes in and inserts, and tight neck is going to pull the face down over time. So much of that sinking and asymmetry is actually from the neck, chest, shoulders, and upper back. So having a tool that can really effectively treat above and below the clavicle, the upper traps, all of our postural muscles in the back of our neck, and also to be able to get to the nuchal fold and the nuchal ligament and the occipital ridge is really, really important in your treatments. This tool also has a jagged edge, and I love the shape for being able to really spiral in the hairline and release the frontalis, occipital, temporalis, all of those big, big, huge muscles. It gets tiring to do some of the more advanced techniques, and having this tool that is very easy to hold, that shape is a huge consideration. Similarly, the tiger's eye seems to fit really nicely in the palm of the hand. This more square shape, I would say, is better if you have larger hands, and same with this longer nephrite, jade, wing, and lotus shape. The thing to point out here is that there are different jagged edges. So when we start to work more on more faces with more considerations and concerns, some of the lines are very deep and some of them are quite fine. So having an option to have a finer edge is an important consideration. So as you can see with the nephrite jade and the gray agate, there are actually two different edges. I don't know if it's showing up on the presentation very well, but having that option is really important to have a finer edge to treat finer lines. So go ahead and advance. Okay, and then, as I mentioned, starting and ending with the lymphatic drainage is important. So the tools that we've been talking about, especially the ones with the edges, are going to be able to better affect and treat deeper layers of the muscle and fascia and really break up all of those adhesions, but also get deep enough to stimulate the collagen and elastin, as well as the hydration from the hyaluronic acid. Using mushrooms, this mushroom shake is great because you can use this at the beginning or end of your treatment and use it simultaneously to treat bilaterally, or especially around the eyes. So that puffy, going back to our balloon image of the tissue being stretched to a point where there is sagging and drooping under the eyes, this is a huge consideration for people. And the lymphatic fluid around the eyes actually can drain both medially and laterally. So as you're going in circles around the eyes, it's a great way to treat very gently that delicate tissue. Similarly, you can use the midpoint of the mushroom to treat the jawline and to to really end the treatment with lifting the jawline and reducing the lymphatic fluid there. The mushrooms can also be used. The shape is great for doing acupressure. If you're working on the neck and there is some channel dredging that you need to do, you're finding upon palpation that there's some obstacles or stagnation, using the mushrooms, there's 2 different sized ends, so it can fit a lot of different areas, and using this along the channel is really great. The rollers you can use in your practice with the 2 different sized ends to similarly drain the lymphatic fluid, but also to apply product. And this is really a great cooling treatment at the end. You can keep them in a refrigerator and it can cool off any skin that has been irritated from some of the more vigorous Gua Sha. I know that in Chinese medicine, we don't like to do too much cooling, but right after the treatment, if there's significant inflammation, it's nice that there is just a little bit of cooling off to remove some of the heat that's been generated. So go ahead and advance. So selecting our stones and crystals is important. So we've talked about some of the shapes and what we're thinking about as far as the depth of our treatment to treat lymph, muscle, and fascia. So what else do we need to be thinking about? As we age, it's about reflecting the light. So when you're looking at tone, this is where I especially think about what stone I'm going to select. So what actual type of stone I'm selecting. And they all have different feels and different properties. And when we're thinking about them both on a therapeutic level, but then also on an energetic level. So as we're aging, we are reflecting light differently. So when you're looking at a child's skin, the light is just bouncing off of that skin. It's very, has a lot of elastin in it. So when you touch it, it springs right back. And as we age, we tend to have more sallow looking, deeper contours. The light doesn't reflect. So actually what we're seeing, a lot of the bags under the eyes is shadow. And so how does the tone look and how do you incorporate this into what you're selecting for your patient? Well, you're thinking about what are their chief concerns and considerations when they're coming in for their treatments. Are they very fiery? They need a bit of cooling. You're seeing a lot of inflammation on their skin. Maybe there's some rosacea or acne, splotchy red spots. You want a stone that's going to be cooling to reduce inflammation. That would be a gray agate stone. Or the amethyst stone is very cooling too. For the agate in particular, I really have found that this stone to me, it's a hydration of the tissue. It releases the constriction of blood flow and energetically transforming negative energy, balancing the chakras. This is like my peace stone. That's why this one is always in my toolbox. The amethyst is always incorporated with the intention, the third eye. So I do love this for treating the glabella folds. It's also very cooling to the touch. This is a great stone, again, for the inflammation, releasing heat and promoting the collagen and elastin. It's a harder feeling stone. So when I'm feeling the actual stone, I think of it for more deeper fascia work, particularly in the glabella fold, as I said, in the frontalis and the corrugator areas. I also relate it to the crown chakra and grace, intention, intuition, serenity. And the rose quartz. The rose quartz is the stone of love. It's a very soft feeling stone. So for someone who has very delicate, sensitive skin, this would be the type of stone that I would select. It is warming. And so anyone who needs a bit more of skin tone, I would select this if their skin is looking sallow or grayish. Definitely the rose quartz is a softer, warming stone. It's very nourishing and it gently promotes blood flow. We always think of the rose quartz as love and heart chakra. So inner harmony, also when treating on the emotional level, the calming, and just really relieving tension and healing. Go ahead and advance. With the citrine stone, this is the, it comes yellow, orange, and sometimes it's a bit clear as well. It's a very strong warming stone. So when I'm thinking about, especially post-winter treatments, where it's been so dark and gray, the skin needs a bit of vibrancy and brightness, this citrine stone is going to be a good option. It's very warming and stimulating. So if someone is a bit depressed, this is the stone that I would use on them if their skin is looking depressed. If they are needing more lifting and toning, this is definitely the stone that I would choose for all of that. So if their skin has a sunken look to it, that the cheeks and especially the jawline has, if it has that really kind of sallow and everything looks like it's been pulled down, this is the stone that I'm going to use to build some energy. So I want to warm and stimulate and tonify. So when we're thinking in Chinese medicine terms, this is my tonifying stone. It lifts the sunken, sagging jawline and neck, and it also emotionally promotes joy, and it aligns with the, I really think of it more solar plexus and transmuting negative energy. The tiger's eye is a stone of courage. So with this stone, I am more wanting to treat the upper back and neck, the postural muscles. It's a very strong stone. So you can use it quite vigorously in the scalp and the neck and the shoulders. And it's going to feel a bit cooler to the touch, but it also promotes the confidence and the strength that I think is really important, especially when we're thinking about balancing the yin and the yang aspects. That is when I select this stone. Nephrite jade is great all around stone for balancing oily and dry skin. So when you have someone who's coming in and they have patches of dryness, but also some oily, I would select this stone. It, to me, is both cooling and warming. So it's going to release the inflammation. It's great for scarring. And it's a strong stone as well, especially for the adhesions in the platysma muscle. And I love it for the nasolabial fold and the frontalis. It will be a brilliant healer for you. It's a dream stone, and it just transmutes negative energy into positive energy and deep peace and balance. And green jade in particular, I know this is one of Shellie's favorites, is to calm inflamed skin. She loves to use the green jade post-treatment. I've also found that this is a really great heat clearing stone, and it's calm, and also to just regenerate tissue and promote positivity. So go ahead and advance. So as we're aging, we're thinking about the weight of the face and how all of this comes together in our treatment. I'm going to go ahead and skip over this slide just to save a little bit of time, and just keeping in mind, like, what is the canvas of our face and how are we treating the face and selecting our stones and what strokes we're going to use therapeutically. So go ahead and advance. Okay, back to these layers of the skin and tying it into our stone. So knowing that 70% of the body is water and that there's this extracellular matrix that's 90% water, we need the tissue to slide and glide, and we need to promote that in our treatment. So Gua Sha is wonderful, wonderful for draining lymphatic fluid. And we hear a lot about that, and we see a lot of treatments that are very, very superficial and gentle. That's a great place to start. What we want to learn is something a little bit more deep to get into these more fibromuscular layers of the skin. We want to treat the muscles and both the superficial and deep fascia, because it is like that segment of the orange. The fascia wraps around all of our muscle fibers, all of our vessels, all of the bones, the organs, all of our nerves and our vessels and arteries. It is so important to be able to release it, especially therapeutically for our facial acupuncture and Gua Sha treatments. Go ahead and advance. So getting a little bit deeper in our treatments is what I want you to start thinking about for using these Gua Sha stones, and why it's important to utilize a number of different stones and really learn which stones work for what conditions on the face, for what types of face, and also what your comfort level is with using your fine motor skills. So we're looking at the contours of the face. We're selecting what edges and angles of the stones are going to fit for that specific person's face, because we're all quite different. We all have different sized jawbones and cheekbones, different space between our eyes. And we're also thinking about what the patient's treatment goals and concerns are. We're thinking, are we working on lymphatic, muscular, and fascia layers, and the depth of the fine lines and wrinkles. So go ahead and advance. So this is how we're selecting what stones we're going to use. So light pressure is for the lymphatic drainage. And we talked about the more basic stones that are great for that. And then when we're looking at treating the muscle and the fascia, we're thinking of a more medium pressure. Now, we don't want to treat with the Gua Sha on the face to create petechia. We want to not have bruising and not have a lot of irritation and inflammation. However, I would say that we do need to be treating a little bit deeper in certain areas and using more vigorous techniques to treat these areas and really affect change. So go ahead and advance the slide. So when we're thinking about our treatments, I'm going to just do a very quick demo for some of the techniques that I was talking about. You're going to select your stones. And what I do recommend is that I get a lot of questions about how do you clean your stones. I include a stone in my treatment. So when someone comes in for facial acupuncture treatment with me, I include Gua Sha in every treatment unless they absolutely don't want it. And I give them their stone. They bring it with them to their treatments and they can use it at home. So we're going to select which stones we're going to be using in our practice and for that particular patient. And we're going to prepare with heating up the face with a hot towel and then applying something to slide and glide, which is a face oil. There's a couple of different ones that I love to use. You're going to really work on your body mechanics to root yourself and connect, take a few deep breaths and apply the oil to their face in a very diagnostic facial massage. So you are feeling with your hands what you need to release and how deep you need to go. If the patient is very, very sensitive in their neck, for example, then you wouldn't want to go as deep as you could with someone who actually likes it's similar to a deep tissue massage. If some people don't like that deep pressure, then you're going to have to use more oscillating techniques. So massaging in your oil or cream, I do prefer the oil. And then you're going to use the light pressure for lymphatic flow, then more medium pressure to release muscles and fascia. And then you're going to go back and drain again with a light pressure. And we're Gua Shaing chest, neck, face, and scalp, and the neck, including the front and the back of the neck. And then I usually incorporate facial cupping, and then this could be a whole hour-long treatment. So let's go ahead and do a quick demo. Okay, hi everyone. So I'm going to start with the amethyst heart. And what I was talking about with the two different sized ends, one for below and one for above the jawline. And so with this is that oscillating technique. So this is a great place to start. And why I'm starting here is that lymph-wise, the head and the neck have 1/3 of all of our lymph nodes in the body. So it's a really important area because lymphatic fluid needs to drain from the brain. And we need to remember that we don't want to just be draining without opening up the huge lymphatic, the largest lymphatic nodes. So there's one back here that we want to start with opening, which is our cervical lymph nodes. And as Shellie mentioned, the subclavian right here. And so I always start my Gua Sha here and travel it back and drain here. And then I go down the neck And right at each lymph node, you want to either oscillate back and forth or do a little pumping action. And then I go stimulate this area underneath the clavicle and out to lung 1 and lung 2 to the axillary lymph nodes. So this is just that lymphatic drainage. It's super light pressure. Now, if the tissue is very flaccid, you may hold with your hand, but I have found that it doesn't really make that big of a difference. Finding just a very comfortable angle and stroke. And there's no fast and hard rules about the angles. It is all specific to your patient. So having what you're feeling through the stone and what I'm feeling are a bunch of adhesions. So using the stone, doing shorter strokes as you're going into the second part of your treatment after you've done the lymphatic to drain. So lighter pressure, longer strokes for the lymphatic, and then deeper and shorter strokes with this basic tool for muscle and fascia. So this is just along the jawline to start to treat that one of the top 2 concerns that we hear, which is the sagging skin, particularly on the jawline. So then taking this long edge, we're going from jawline just underneath the zygomatic bone, and again here, and then I always go outward and drain. So this is just lymphatic and lifting, outward and drain, lift, oscillate, go outward, oscillate, and drain. Okay, so moving on to a more advanced stone that has more shapes and sizes. We can use the rose butterfly. So these were the little wing tips that I was talking about. What I love about these tips is that they're slightly rounded, and you can release right here along the border of the procerus muscle to really affect these 11s. So this is a little bit deeper. It's a very sensitive area for people. And you can treat the corrugator with this tip. It's great for just above and below the eyebrows. And then also using that very, very tip to go perpendicular to the lines. So my lines are vertical. I'm going horizontal across. And then you can also use your fingers to spread the skin to get a little bit deeper and stimulate a little bit more. And then using these tips again for this line here, going to get deep into the tissue here to release it. Now this is where I'd be using stronger pressure. And then again, going across the lines. So similarly, we can use this, my favorite tool, because it fits right in the palm of the hand. So as you're thinking about your body mechanics and what stones you're selecting, the size and shape do matter. So I hold this almost like I'm doing an okay sign. And this gives me a lot of fine motor technique. And the tool is sitting in the palm of my hand, so I have great control over it. I love this to take the jagged edge and very delicately going up and down. Clients love this. It feels so good. And it's very, very gentle because this tissue, I'm actually underneath the very delicate tissue. I'm not treating on top of it. So this is right on my zygomatic arch, but I'm draining lymphatic fluid. And it's just a very delicate up and down. Similarly, with this jagged edge, we can start getting into the temporalis and doing spiral strokes all the way back to the occipital ridge and then going back and forth. I know I'm running out of time with my demo, so I do apologize if I'm going a little bit quickly, but I just wanted to show you all a couple of really quick techniques that I think are really helpful in their practice. So while we're doing the temporalis, we look here, and this muscle really does affect the eyes. And incorporating the scalp Gua Sha into your practice will change it significantly, especially to release this frontalis muscle for the forehead creases and fine lines. The frontalis muscle and the platysma muscle, the banding that we see, those horizontal bands, are actually from tight underlying tissue. And then the skin on top becomes flaccid, and that's what's causing our lines. So we want to really be able to treat the lines both with the jagged edge, but also releasing the muscles that are pulling on them. So in this case, it's releasing our frontalis muscle all the way back. And then the platysma muscle, we want to be able to use, for example, this side to treat the jawline. And you'll hear and feel little crunches. Those are all the adhesions that we want to get nice and deep to treat. And then also being able to treat, I go more below first, and then right on top of the clavicle to treat the platysma, and not forgetting all of the muscles in the back and shoulders. So such a short little overview of some of the demo techniques. But again, the big takeaway here is to always use the lymphatic drainage. So we're always going to be draining the lymph first, and then going deeper into the muscle and the fascia with more vigorous, deeper strokes, avoiding those types of strokes on the very delicate tissue around the eyes, and then also being very careful on the anterior neck. But everywhere else can really handle a little bit more depth and stimulation than we usually see. And those are shorter, quicker strokes. And then always, always ending with the lymphatic drainage, and keeping in mind, this is your largest lymph node for the upper body. So you need to open this up first. If your drain is clogged, you're just going to be pouring more water into the bathtub, and it's not going to be going anywhere. So start here with opening, then the second, and then third right by lung 1 and 2. So with that, if we can pull the presentation back up, please. So we're just going to hopefully stay in contact. I love talking all things Gua Sha, so please feel free to reach out to me. We can have some nice one-on-one Zooms, and here's all of my contact detail. And then if we advance the slide, we'll have Shellie's contact information. And Shellie's going to come back on to talk a bit more. I'm going to mute myself.
Well, before you go do Carrie, I just want people to notice when Carrie was doing the one side of her face, if you look at the difference after she completed just that slight demonstration, there was a significant difference between the side that she did and the other side. So when she comes back on, take a good look.
Thank you, Shellie.
So if you want to stay connected with me, Shellie Goldstein, here's my Instagram profile. I periodically do demonstration videos similar to what Carrie did today. I do have a website and an email if you have additional questions. And then also if you can go ahead and advance that slide, Susan, I appreciate it. Okay, so Carrie and I both teach. I owned the Academy of Advanced Cosmetic Facial Acupuncture, and Carrie and I have partnered with the Pacific College of Health and Sciences to present the facial applications for cosmetic enhancement, or the FACE program. Go ahead and advance. So this program is an 8-month program. It's through the Pacific College. And what's unique about this program is we have not just ourselves, but additional leaders in the field. We have Matt Callison, Yu-Ying Lee, Creso, Simesis, Deirdre Courtney, and a number of other people who are the specialists in their field. And we've all come together under one roof to offer you all of our assistance and knowledge that we've gleaned over our decades of practice to help you become next year's leaders. So if you want to know more about that program, we are in the middle of the first one. The next one starts in 2024. There's the information, email address, and phone number for contact. So that's all that I have to say. We can take the presentation down. I know we only have a few more minutes, but and I tried to answer some of the questions as we were going along. So, but look at the difference between Carrie's sides of her face. It's really, can you see the difference between the side that she treated? If you can see how much more lifted her eyebrow is, her cheekbone, the zygomatic bone on the side that she treated is much more lifted, and her whole face looks a little bit more elevated on that side. So, and that was just a little demonstration. So,
and this nasolabial folds a bit better. I also just wanted to show that the mushrooms around the eyes really quickly, because this is one of my favorite places to end. So it feels so good right now. I do see a number of questions.
I did try to answer some of them.
Okay. Yeah, we can get right into that, actually. Yeah. Okay. Is there any complication counterindication with those who have had lymphatic surgery? I've had cancer patients with drainage issues. Is this an appropriate option for them?
Is the cancer resolved?
No, I don't know if we're going to get an answer.
That's always my question is, you know, I think it depends on each patient. That's really a more, that's a significant concern. And I think it just depends on what stage they're at in their treatment and their care. The lymphatic massage is great for many different patients, but with the cancer, it just depends on what the circumstances are.
Yes, I would certainly have them consult their physician regarding treatment before getting treated with anything, not just Gua Sha, but anything that could be questionable in the eyes of their physician, mainly because it could be helpful, but you certainly don't want to get blamed for something that has nothing to do with you.
Yeah, exactly.
Patricia asks, what do we do for bags under the eyes?
I think you answered that, Karen. I think
the bags under the eyes. So again, thinking about that balloon and the tissue. So you will want to continue to drain the lymphatic fluid, but also be able to stimulate some of the collagen and elastin, especially around the zygomatic arch, and then even into the temporalis and the outer eye. You don't want to treat this very delicate skin, but if you can promote a bit more fluid, especially for the collagen and elastin, and to reduce the puffiness for the inflammation, that is really going to help the bags under the eyes. And whenever we're lifting in a certain area, so if you're just lifting here, you can see how much just this little bit on my temporalis lifts my under eyes. So just keeping that in mind, that this is a really important, this scalp area is really, really important to treat.
Okay, how do we sanitize?
One last thing, to the extent that you can release the jawline and the platysma muscle and the neck, all the things that are pulling down on the skin, that is also really important. So it's not just about lifting and toning, it's also about releasing the underlying tissue, the fascial adhesions and the muscles that are pulling everything downward. So look at the patient and figure out what is causing asymmetries and what's pulling downward.
Great. How do we sanitize a stone tool?
This always comes up. I said it right in the beginning because it literally every single class and presentation. So washing your own stones at home, soap and warm water. And then if you're using the same tool on a patient, especially during COVID, I started including the cost of a stone in my treatments. So they bring their own stones, and that concern is just gone because it's their stone. You can wash with soap and warm water. You can alcohol swab, and then you can also use some sort of a light to sanitize, like the autoclaves. Or I know Shellie sometimes use the colloidal silver. Obviously, be careful if someone has a silver allergy. But really, it is a nice thing for your patients to have the stone, and for you to be able to include those in your treatments, or add an additional cost for them to purchase one. It's really great.
Colloidal silver is great. It's a spray. It's a sanitizer. It's a disinfectant, antiviral, antifungal, antibacterial. I use it all the time in my practice, and it's also great to spray on the stone so it doesn't damage.
Yeah.
Thank you for recommending that. Sharon asks, what topical do you like to use on the face to reduce friction, improve comfort during facial gua sha?
Okay, so two of my faves. I usually cocktail. So I love the sea buckthorn oil. Any kind of oil is really my preference. The oil just has a nice glide. You always have to be careful of what people are sensitive to. So the sea buckthorn's great for balancing the acid mantle and helping reduce oily skin, especially for acne-prone patients. And then I use an Amy Raup rejuvenating facial oil. This one is great for helping with melanocyte production. So if you have skin that has hyperpigmentation, sunspots, this oil I've found to be really, really great for reducing them. So it depends on how hydrated their skin is as well, whether I use something a little bit thicker or a little more gliding. But these are two of my favorites. I prefer the oil to a cream.
Okay, Heather asks.
And I always look for cold pressed, all natural, no fragrances, you know, organic, like the best products possible is what I recommend. Highest quality.
Perfect. Heather asks, beyond fine lines and wrinkles, can you discuss the benefit of facial gua sha for scarring and, if applicable, sunspots and discoloration?
Certainly. Do you want to take that one?
I think it's a huge topic. I think it sounds like a great Gua Sha part 2. It's just a huge topic, and they're all great questions and important concerns, and require a lot of explanation. So,
but okay. I also think high level, we think of the sunspots as stagnation, blood stagnation, and the scarring also as an excess accumulation and stagnation. So let's do a part 2 where we can break up. Those can be our top 2 concerns.
Sounds good.
How to break up stagnation.
Jolene asks, what determines which type of stone is best to use for a patient or condition? Rose quartz, citrine, amethyst, etc.
Yeah, I'll refer you back to the slides because I do outline different properties of the stones. So considering the tone of the skin, sallowness, inflammation, if they're looking like they need something that is more warming or something that's more cooling. So if we're thinking about from Chinese medicine perspective, you know, our 8 questions, excess, deficiency, hot, cold, incorporating that into your stone selection.
Okay, we have, how often are the treatments done, or is the treatment taught to the client to do at home?
Yes. How often is it done? I like to Gua Sha daily. I have one in my purse. I have one at my bedside. It's always great to at least lymphatic drain, right? So keeping, as Shellie mentioned, there's no pump on the lymphatic system. We have to have a bit of help there to keep the fluid moving. And so at least being able to drain lymph. Doing a more vigorous treatment, you might want to consider a couple of times a week. And your patients, absolutely, it can only help their conditions improve the more they practice at home. So even just before this presentation, I was Gua Shaing my glabella folds. So it's about consistency. So having a routine, but making it also simple. So starting with a more simple tool, getting really comfortable, having the development of your fine motor skills and your techniques and your pressures, and then moving to a more advanced stone. It becomes second nature, just like writing cursive.
What do you mean by finer edge? Does nephrite jade have this, but agate long does not? Or am I mistaken?
Yes, so this tool is one of the nephrite ones. It's not showing up really well here on my camera, but you'll see that these are the bigger jagged edge, and then this is the more fine. So I would use this fine one here, and I would use this bigger one here and here, right? So, and the finer line just in general, if someone has more delicate, sensitive skin, if the skin, sometimes with more aged skin, it's very very paper thin. And so you do need to be more cautious with how your body mechanics are, as far as not overstretching it, and also using something a little less vigorous, like this finer tooth. And your question about the agate long, no, it has a medium edge on it. And then the one that has 2 is the lotus shape. I think that answers all parts of the question.
I think so. Are there conditions you would not use a specific stone for?
So I would be cautious and not use a stone over any active acne or sores. With the acne, you don't want to spread the bacteria, but you still can treat other areas to promote circulation and lymph flow, and to help the body start to flush out and turn the tissue over. Active cancer. Shellie, what else would you consider not using a stone with?
Yeah, for me, I think that anything that's questionable, certainly active open lesions and cancers, but just in general, if there's even with lymphedema or something like that, if there's anything that could be a concern, consult your physician or your primary care provider. So that's kind of my general overview about that. Even I know it sounds very conservative, but even something like pregnancy, there is no reason to not offer facial gua sha for pregnancy, but just to err on the side of caution, if you feel concerned or if there's a red flag of any sort, 99% chance it's okay, but I would just err on the side of caution and ask them to consult with their primary care provider.
Okay. Carrie, did you design the stone cutting?
Yeah, so I work with a number of different partners, and I have designed some of the shapes that are being used with the particular stone. So I'm always keeping in mind like how I want to treat and with what stone. So I love these tools. They're very, very beautiful, and they're wonderful to work with.
Okay. Regarding the jagged edge, wondering if other edges are useful for nasal labial folds. Also, is there an advantage to using these tools in addition to ours instead of manual lymphatic drainage technique with fingers?
Is there an advantage to using the stone? I love using both. So when I'm applying the oil or the slip, whatever glide you're using, I am diagnosing with my hands. I think touch is really important, especially post-COVID. People want to have that massage part of the treatment, and it's great diagnostically, right? So I saw another question about treating supine. You can absolutely treat all this. You just turn the head and massaging the neck, releasing at the occipital ridge. It's all part of the treatment. And it's used to both apply the slip, but also to diagnose and start the lymph from draining. Think of a bathtub. You don't want to just add more water to it. You have to start opening things up. And so the advantage to using the tool, you still can feel the adhesions with the tool. And I actually feel things differently with the tool. Like I feel a lot more through the stone. And it's in a different way. The question about treating the nasolabial fold with something other than a jagged edge. Yes, you can take, this is the amethyst. You can take this edge, and it's about stimulation. So I am just going back and forth. And then I'm using this tip right in here. This actually feels so good to open up this B-tongue, large intestine 20 area, and just getting right in and draining the sinuses even. So yeah, you don't have to have the jagged edge. Even just think when we start to think more about the tissue and the piezoelectric effect, this is going a little bit deeper, but what is going to stimulate collagen and elastin is pressure. So it doesn't have to be the jagged edge. It can just simply be the pressure of the more basic stone.
Okay, we'll try to get to a few more questions here.
Okay.
What do the adhesions feel like when you're gliding the stone on tissue?
So the adhesions, especially right here, it feels like little crunch. It's like a little crunchy bump. And especially with the neck, even if I've already diagnosed and massaged with my hands, when I'm taking the tool, because I'll start the upper traps and go all the way up to the occipital ridge. So refer back, please, in the presentation to where the lymph nodes are. So if we're thinking about lots of lymph nodes out here, also along the occipital ridge, subclavian, axillary fold, we want to, at our stroke, where the lymph nodes are, go either back and forth or pump it. And when I'm doing this longer stroke, I will feel a bump. It's just like it's a knot. It's an adhesion. It's the fascia. And I can take the tip of a stone and it's like an acupressure point, and circular motion up and down like this, back and forth, and just thinking of releasing that tissue. You'll feel it. You'll feel it through the stone, maybe more so than through your hands.
Okay, we have a lot of questions here, so I think we're just going to do no, that's okay. Yeah. I think we'll just do a couple more because I want to be respectful of time, and then any that we don't get, anyone can email us at marketing@lasaoms.com and we can try to answer those. So we'll just do maybe 2 or 3 more. How much do you charge for a session and how long?
Well, it depends on what they're coming in for. So I do offer a more comprehensive acufacial that includes more ancillary techniques, that is microcurrent, LED light, and things like that. That is going to be charged a bit more than just facial cosmetic acupuncture with Gua Sha. I also just do Gua Sha treatments too. So it's all different prices. It just really depends on what we're treating and what we're doing. But generally, the treatments are an hour and 15 minutes. And you also have to factor in about 15 minutes on each side, because I do have people wear a robe, like a wrapped robe, so that I can really treat their upper back, shoulders, back of their neck, and the chest area, because it's so important for treating the face.
Okay, I believe you said this in your presentation, but is there a preferred face oil lubricant, or do you like to use the stones on clean skin and apply something after Gua Sha?
I do have a number of different oils. What I would recommend is that you really look at the ingredients and you know the ingredients, and ask the question of what your client may be sensitive to. They also need to like the smell of it. So if it does, most all of them do have some ingredients that have a certain scent. It's not fragrance. You definitely want to avoid fragrance, but having the most natural and organic, clean products is great. And I prefer the oil. Yes, you need to have slip on. I always recommend that, so that the stone glides and it doesn't overstretch the skin. Okay. And then also it's therapeutic, because using a good oil or cream on the face is also giving more of a treatment, and the stone is helping it penetrate more. And I did dodge the question about the pricing. The cost of treatments range from $90 to $425. So okay. Just depending on what we're doing.
Yeah, I think you actually need to, that's true. That's what we charge in New York. But if you, depending upon your area the area that you live in, I think your price is going to need to be adjusted. And then also, from my experience, you can, like Carrie said, you can add it to a service, or it can be its own service. And then there's a whole strategy about pricing, based on the value of your personal value and your costs. So look at what's around you. Is it an add-on? Is it, in which case Carrie said the price would be on the lower end. And if it's own service, then you can certainly make it a little more expensive.
Great. Last question. Any tips for those who have visible veins near the center of eyebrows, 11s, and chin area of jowls, the 2 biggest problem spots?
Well, we went over some of that. We went over the 11s and gels. You know, your questions are wonderful, and there's so many good answers for them. I really think we need a part two, but because we are squeezing in days, a 2-day seminar into an hour. So, you know, again, go back to Carrie's notes, take a look at the different tools, take a look at their properties, watch her demonstration again. There's so much information in this 1 hour that I think that if you go through it again, you'll see a lot. And good questions, really good questions, everybody.
All right. Well, thank you so much, Shellie and Carrie, and thank you everyone for joining us today. If we did miss your questions, I know we didn't get to everybody, please feel free to reach out to us at marketing@lasaoms.com and be on the lookout for an email with a promo code and a link to view the slides and the recording. Thank you again, everybody, for joining us, and we look forward to seeing you at our next webinar.
Thank you. And check out Carrie's tools at LASA OMS. Thank you, LASA, for hosting this, Karen. Thank you Robin, thank you so much. It's been wonderful, and I look forward to more. So
thank you both.
All righty. Use the discount code. So. All right. Bye-bye, everybody.